Hi, last time we got together we talked about exercises for the aging knee. Today we want to talk about core and what actually is the core. A lot of people have the misconception that the core is just the abdominal muscles. Well, the core is the center part of the body, and those are the muscles that literally control the arms and legs during any type of movement, whether it be a sport, walking, throwing, getting up and down off the floor. Those are the core muscles. All right? The core muscles comprise the muscles that go from the base of the skull down to your legs and anything in between. So what I want to do today is I'm going to illustrate how to actually do the exercises for the core muscle groups. We're going to start with the abdominal. Okay, so the first abdominal exercise we're going to do is called the abdominal crunch. So when you look at the abdomen in general, all right, I'm going to flip around this way so it's easier to see. All right, you have to take the hip flexor out of the motion in order for the abdominal muscle to contract completely. Now the hip flexor, or the psoas muscle, is a very powerful muscle, all right, and it originates the inside of the thigh bone, goes really deep through the abdomen, and attaches from T12 down to L5, all right? It's commonly referred to as a psoas. And that muscle lifts your legs straight up like that, all right? That's what it does. It also gives you spinal support to lower back, okay? So if you want to correctly get the abdominal muscles to work properly, you have to shut that off. And the only way to shut that off is to lift the legs up and flex the hips greater than a right angle. When you do that, the hip flexor is taken out of that motion, all right? And the abdominal muscles can contract fully. So either you can cross your arms across your chest or put one hand behind the head and one on the abdomen, all right? So if you cross your arms across the chest, you want to roll into a ball. Now when you do core movements, okay, you want to do them slowly and controlled. So on the way up, you blow out, count to 4, down, 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 down. Now that one's commonly referred to as the abdominal crunch. The next one we move to, I call it neck flexion, but it'd be like a crunch for the neck. All right, that's going to work the muscles behind the ear down to the collarbone. So you put your head flat on the bench, tuck the chin in, lift the head up. Again, it's the same slow 4 count. Back down and up, down and up. And this is an area that a lot of people do not exercise. Go to any gym, all right, even sports centers where they work with athletes, very seldom do you see them exercise the neck. Well, the neck holds the head up. Head weighs about 15 pounds. Try to take a bowling ball and hold it in your hand in front of your body and see how long it takes before you have to put that ball down. That's the head. All right, so the neck muscles are very, very important, all right, when it comes to stabilization of the whole upper body. So that was neck flexion. From there, we're going to do the muscles behind the neck. So you roll over on your abdomen. Okay, tuck the chin in and pull the head back. That's the motion. Again, all slow count. 4 up, down, up, down, up, down. Okay, that's we call that neck extension. There, you want to roll back over on the back. Okay, you want to work the lower abdominal muscles. Now, the abdominal muscles are made up of 3 groups of muscles. You have the rectus abdominis, which goes from the sternum down to the pubic bone, all right? Then you have the internal and external oblique, okay, which works from the side. Then you have the transverse abdominis, which we'll get to in a moment. The lower abdominal, or what we refer to as reverse crunches, okay, starts with the hips flexed again at the right angle. You want to try to lift the lower back and the butt off the bench. Down, up, down. Now you may prefer, depending on the individual, because it takes extremely strong abdominals to do that with the arm at the side. If you don't have that, then reach over the top and grab the bench with your hands and use that as an anchor and lift up and down. Again, it's about a 3 or 4 inch lift. Up, down, all right? All these movements are done between 20 and 25 repetitions. They're very slow, 4 counts at the top. Take 2 counts to get down, touch and come right back up. The last one we're going to do is called vacuums. Now this is an exercise you never ever see, all right? Because the transverse abdominis muscle actually works almost like a girdle. So if a person has a lifting belt on to give them lower back support, okay, if you get the transverse abdominis muscles to work correctly, all right, then your lower back issues, in a lot of cases, can go away. So how you actually do it is you do a vacuum or a suction of the abdomen. So instead of contracting this way, you're actually sucking your gut in, thinking or visualizing, touching your abdominal to the bench or your back, like this. Okay, that's strengthening the transverse abdominis muscle. Very, very important movement. Okay, then you want to roll over on the back, and you want to work your lower back muscles. Okay, what's referred to as the erector muscles of the spine. All right, this is one area that people really neglect. When you see people go through physical therapy for back issues, very seldom do your therapists actually do back extensions. When you think about, most of the muscles in the core area are behind the head, okay, and down the back. You would think those would be exercised more, but they're not. They put more emphasis on stretching the hamstrings, which we'll talk about sometime down the road, okay, and just doing exercises for the abdominals. So you put your arms along your side of your body, okay, keep your chin tucked in, and then try to arch the back slightly. It's just a slight lift. Okay, so if we keep those exercises in a routine, again, you can do those daily because those muscles, they work continually when you're standing upright. They're always contracting, okay? So you can't really overwork them, all right? So from here, we want to go to your secondary stabilizers. Okay, and the secondary stabilizers help assist the main stabilizers, which are the ones we just did, okay, in holding your upper body upright. First thing we want to do is called hip hyperextension. That's going to work the glutes, right, and it's going to reciprocally relax the hip flexor, which causes a lot of lower back issues. 75% of lower back problems are caused from tight hip flexor muscles, or what we call the psoas, right? The hip flexor does this. So when a person sits a lot, that muscle actually shortens. We call that adaptive contraction. When they stand up then, because it can't return to its normal normal length, which is opened up, it's adapted to a shorter length because of sitting. It pulls on the lower back and causes lower back tightness, okay, and pain. So in order to correct that, you have to actually open the hip up by lifting the leg back, which we refer to as hip hyperextension, back. You're working not only the glutes, you're working the hamstring, okay, at the same time you're relaxing a hip flexor or the psoas muscle, just like that. Okay, you want to hold it for 2 counts. This don't have to be as slow as the ones lying down, okay. From there, you want to work the glute, what's referred to as the glute medius, okay, which is a smaller muscle deep in the buttocks, okay. You can stand on a block like this. You can use a CMF machine, which we'll talk about down the road, how effective this piece of equipment is. Designed by Dr. Bob Guida. Bob was a Mr. America in 1968, okay, and a Mr. Universe. And it's the only piece of equipment, pulley apparatus, that actually works stabilizers. Those are balancing muscles. It's the only one where your strength curve is constant from beginning to end. Machines do not do this. This piece of equipment does, okay? So when you want to do hip abduction, okay, again, you want to balance yourself, all right? Okay, foot starts in front, toe forward, okay, or slightly in. Don't toe out. When you toe out, using your upper part of your thigh and the hip flexor, toe forward or slightly in, the hip will lock at about a 45-degree angle. And when you come up like that, the inner thigh or the adductors will relax. They will stretch, okay? Now, you want to work the opposite now. You want to work the adductors, so you bring your leg across the front. We call this hyperadduction. Okay, so this is the motion, across the front. Now, you notice that machines don't do that either. With the CMF machine, you can do that. Okay, and when you do that, you get a stronger relaxation, okay, of the IT band, which in a lot of cases causes lower back problems, okay, and also knee problems. All right, so that would be the muscles for the hips. From there, we want to move to the shoulder blade area, because the shoulder blade is very, very important to core stability as well, because the shoulder blade have to be attached to the vertebra. Okay, so we want to work the muscles that actually do that. First one we want to do is called retraction, where you're working middle traps and rhomboids. And this is a motion that very few people actually do. Okay, and how you do that is use a rowing machine, or you can use dumbbells, lock the elbows out, and just squeeze the shoulder blades. That's the motion. So when I'm actually doing this movement, not only am I exercising the muscles between my shoulder blades, I'm also relaxing my pectorals, or what people call stretching, stretch the pecs, but this is the appropriate way to do it, all right? Because you're using the nervous system, the muscular nervous system, to initiate that response of causing those muscle fibers to relax and return to their normal resting length, which then increases range of motion, okay, a freedom of movement. So again, that's called retraction. From there, you want to do an exercise that actually works the lower part of the trap, and I call this the monkey dip, but we call this actually referred to as the pressure. So when you do the motion, you either get on an apparatus like this, okay, or you can use the machine. You drop the body down, come up, down, up, down, up, down, up. Now, when you do this exercise and you get in the down position, you push back up. What you're also causing is a relaxation of the upper trapezius muscle. The traps are divided in three sections: upper, middle, lower fibers. It's the lower fibers that are never really exercised by most people. So when you do exercise those, the upper trap muscles relax and they go to the base of the skull. All right. So if you put all those movements into your exercise routine, not only will you have a stable, strong, powerful core, but your back issues will literally will go away. And these can be done by almost anybody.